And I guess we're done now. Dean James, he's the CEO of Imaging 3 Incorporated, stock symbols IMGG. Dean, good to see you again.
Good to see you too, Don.
Now, Dean, we've had the pleasure of talking to you before, and you've got this remarkable medical imaging device that, to me, kind of blows away the status quo, because yours is portable, it uses regular 110 electricity, it walks right into a room. We've got some footage of it here that we'll look at while you're talking about it, but tell us about the Dominion.
Well, it's a breakthrough, a true breakthrough imaging technology. It's a mobile device, it plugs into regular wall power like you say. It scans the body every 360 degrees, every 0.2 of a second to 0.8 of a second. It takes those images, puts it into a 3D construct, and then updates it again every 0.2 to 0.8 of a second, thus giving you real-time 3D imaging. And that's volumetric imaging, meaning your body, we all exist in 3 dimensions, so now you're viewing within the human body in 3 dimensions in real time. The existing technology is all post-processing. It takes about 20, 30 minutes to take the images, another 15 minutes to give you 3-dimensional imagery, the 3-dimensional construct. So you're really looking at 45 minutes of imagery 45 minutes ago. So our device is producing that every time, every second, in real time.
Well, it's amazing because, again, like anybody who's gone through an MRI, you go in and you're in there because of some reason. You know, you're concerned about something. Your physician is concerned about something, and you don't get your results back for a few days.
Right.
Because they don't, like you said, they don't have them for 45 minutes to an hour. And then, of course, for some people, that MRI process is very claustrophobic. Right. You know, just looking at that picture a moment ago, this is a wide open thing. There's no claustrophobia involved.
Right, it's a huge borehole into the gantry, so claustrophobia isn't really a part of this. You know, you're not being so confined to such a small space. On top of which, you know, trying to get, say, a CT or an MR scan, say you just walk into the ER and you have some trauma, you have to fit into the queue, into the radiology department, and you could sit there and wait for minutes or hours to actually get that scan done, where our device can actually move to you, scan you instantly, and save your life in some instances.
Well, the healthcare facilities and providers must just be gangbusters over this because even from the infrastructure standpoint, it rolls right into a room like it rolled into our studio here. You plugged into a regular wall outlet, and then have to take out a wall to install this thing, so to speak.
Or add layers of shielding or any of those problems. Yes, I mean, as we had discussed earlier on another show, we were darling of our trade show, RSNA, Radiological Society of North America. I mean, we've been visited by hundreds of physicians from all over the world that are just dying for our product to get FDA approved.
Well, I'm glad you brought that up. You're reading my mind. I got a little less than a minute left. Do you have any idea where you stand on it? I know you're telling us it's an if process. Excuse me, it's a when process, not an if process. It's close, right?
Well, we've made several strides with the FDA. I can't really say that it's going to happen tomorrow, but we've made some significant progress. Okay.
Once again, Imaging 3, the stock symbol's IMGG. If you'd like more information about the company, give us a call, 888-259-4449. Anything to add before we say goodbye?
Well, I think your viewers should know that Imaging 3 is a great company. We're on the verge of FDA approval and hitting some major milestones. I think this is what most small investors are looking for these days, is a breakthrough technology and a breakthrough company, and I think that's what we are. And
very quickly on the FDA, you have experience with this. You've actually been approved for other applications in the past, correct?
That's correct. This is my 5th 510K, so I've had some experience there, yeah.
Imaging 3, IMGG. Dean, I can't wait for the news.
Definitely. Me too. Thanks, Don.
Well, be sure to join me this weekend on the Money Wrap radio program as we kind of go down memory lane. We're going to talk about back when GM ruled the world. It's an amazing story what's happened to this grand company here recently. For more information or to find a radio station near you, go to moneywrap.com. Call us right now, 888-259-4449 for free information and mail about our featured guests, including Empire Energy Corporation International. When you do call, be sure and ask to be added to the subscription list of our Money TV newsletter. It's an email publication. Again, 888-259-4449, or visit us online at moneytv.net. That's our program this week. Be sure to see us again next week. Thanks for joining us.